To orientate ourselves to the anatomy of the Piriformis, let's find some of our bony landmarks. So we have the greater trochanter where it attaches to, and it comes from the anterior surface of the sacrum. So if we find the apex of the sacrum down at the coccyx here, we come out to laterally to find the inferior lateral angle. So it's in line with the PSIS as we palpate. So if we find the posterior iliac spine there, we come down off it, and it really is roughly in line with that. So it's the angle of the sacrum as it then turns the corner and comes back up. So if we find the angle of the sacrum, the inferior lateral angle, the piriformis rises just above this or at the same position there as where you'll find the angle. So again, it comes off the anterior surface of the sacrum and then comes out laterally to the superior border of the greater trochanter. It's quite deep as it comes off the sacrum, and as we palpate the muscle and move laterally, we'll feel the tendon of the muscle as it attaches into the superior border of the greater trochanter. There are obviously various muscles that are involved in the internal rotation of the hip. So this is one of the cluster of tests that will implicate an internal rotator. So to test for the strength of the internal rotators, in this case we're implying that it may be related to the piriformis, what we're going to do is flex the hip to 90 degrees and the knee to 90 degrees. From there we'll instruct the client to keep the knee pointing towards the ceiling as they try to bring and rotate their heel towards the opposite shoulder. In doing so, as the examiner, we're going to resist the force there while stabilising the knee and stopping it from moving in or out, and then test for the resistance and the activity of the internal rotators. Once we've completed our testing, we're going to compare that to the other side and obviously confirm further with palpation. To assess for the length of the piriformis muscle, we'll first position the client in a supine position and we'll put them into the stretch position for the piriformis muscle. So we'll take the leg and rest it up on the opposite thigh, so without the foot resting on, so just above the ankle, resting on the opposite thigh, and we'll take that hip towards the chest, asking the client to hold their own thigh there, and that'll just free up your hands as the clinician or the examiner. From here, we want to take the hips towards the chest, but we want to maintain the pelvic position, in particular the sacral position, because the piriformis attaches to the anterior surface of the sacrum. So we take the leg up as high as we can. Once we feel the pelvic position move, we'll stop there. And in this position, we'll ask the client to push the tailbone down into the bed a little bit more, and that will take the surface of the sacrum away from the insertion on the femur. From here, to increase the length at the distal portion, we'll also externally rotate the hip as well. And you'll see there at the attachment there, the femur moves away from the origin of the sacrum, lengthening the tissue. So from here, we can feel for the resistance of the movement. And of course, we're going to compare that to the other side. For a strength application to the piriformis muscle, we'll first place the muscle in a lengthened position. In this case, we have the client in a sideline position with the hip flexed. We have the knee adducted across the body, and what we'll do is consider the line of the muscle, so as it originates from the sacrum just around the inferior lateral angle and comes off to attach into the greater trochanter, the superior border. We'll continue we'll think about the fibre orientation and continue the length or the direction of the femur to have the femoral shaft in the same direction, so taking the hip up so that we have a straight line here. We'll measure a length of tape to cover up the muscle, and we'll remove the tape off the backing and let the initial anchor settle to zero tension before placing it on the sacrum. From here, we'll remove the backing off to our final anchor, stretch the tape out to 25 to 35% tension before laying that on the muscle. At the final anchor, we roll the tape off the backing, let it settle to 0 before applying it to the greater trochanter. Rub the tape to activate the glue, and once we've completed our strength application, we'll make sure to reassess the muscle for any changes in strength as well as any functional gains. For a length application to the piriformis muscle, we'll position our client in a lengthened position. So in this case, we have them in side lying with the hip adducted across and resting on the bed. What we'll do is consider the fibre orientation and the line of the muscle pull. So as it rises off the sacrum, the anterior surface here, we'll find the inferior lateral angle and then orientate that to the superior greater trochanter. We continue the line of the femoral shaft in line with those muscle fibres that we're interested in taping. And from there, we'll measure length of tape to cover up the muscle. We'll remove the tape off the backing and let the initial anchor settle to 0 tension before placing it on the greater trochanter. We roll the tape off the backing with 15 to 25% tension and then let the final anchor settle to 0 before placing it on the sacrum. Rub the tape to activate the glue, and once we've completed our taping, we'll reassess the muscle for changes in length, as well as any strength changes if that was in deficit, as well as any functional gains.